This is Radio Health Journal. I'm Reed Pence. This week, living with the uncertainty of an undiagnosed disease.
Remaining undiagnosed is really frustrating on a day-to-day basis.
Finding answers to a deadly riddle when Radio Health Journal returns.
I'm Nancy Benson, host of Radio Health Journal. If you enjoy listening to Radio Health Journal, you'll also like our sister show, Viewpoints, which covers a wide array of topics from education to history to the environment. Here's a preview of what they're covering this week on Viewpoints.
I always tell people to go to Fenway Park. It's historic. It's been around for over 100 years. It's still really great to look at. It's quirky. It's a cool vibe around the ballpark.
Getting back to the great American pastime, baseball at the ballpark. Then
they would lie about their positions. They would lie about their titles. They would lie about whether they'd been married before or not.
Inside the world of wedding announcements, I'm Marty Peterson.
And I'm Gary Price. These stories in depth this week on your public affairs magazine, Viewpoints.
Listen to Viewpoints on your favorite radio station and subscribe and listen to shows anytime on Apple Podcasts and Google Play.
When we're sick and visit our doctor, most of us probably take it for granted that they'll make a diagnosis, prescribe a treatment, and send us home. Sometimes our primary care doctor may refer us to a specialist, and we go through a battery of tests. Maybe they discover something serious, like cancer or diabetes. The news is devastating, but at least we have an answer and a course of treatment. But imagine how you'd feel if one specialist after another says, "I'm sorry, I don't have any answers," or even, "I've never seen anything like this before." That would be terrifying. And it's the experience for hundreds of patients in the U.S. every year.
I've been known to say in my more dark moments that sometimes I just wish he had cancer, because at least then we would have a plan, as opposed to just this kind of constant day-to-day uncertainty.
That's Megan Halley, mother of 6-year-old Philip, who suffered a major stroke at age 2 and required a liver transplant at age 3, which his body continues to reject. Numerous tests and countless surgeries have turned up no diagnosis for what's causing Philip's disease. Additional symptoms include blood sugar instability, hypertension, as well as significant cognitive delays and behavioral problems.
Remaining undiagnosed is really frustrating on a day-to-day basis. We're managing 20-plus medications a day that change weekly, partly because we have no principles on which to make medication decisions. Half the time we're trying to decide whether, we need more of the medication or less of it to fix the problem we're seeing, because we just don't know the underlying cause or anything about the kind of underlying physiology that's driving repeated rejection of his transplanted liver, issues with his bones and his blood sugar and his diet, his appetite. And so, there's just not a frame of reference for decision-making.
Some patients with rare diseases go undiagnosed for years.
I started noticing some unique muscle loss and muscle weakness symptoms back in 2005 through 2006. I started seeing local physicians in Utah, and thus began my diagnostic odyssey.
That's Troy Evans, who was an athletic young man in his early 20s when he noticed weakness in his lower limbs. Today, he can walk only short distances and cannot rise to stand or climb stairs without assistance. But he doesn't know why.
I never envisioned a world where there are diseases that are undiagnosed. It didn't cross my mind until I got deep into this path. The first year or two of visits, it still didn't cross my mind. I was doing an EMG test. I was doing blood tests. I was doing a muscle biopsy, et cetera, through 2007 and into 2008. It still didn't cross my mind. There's a chance this isn't known. Didn't cross my mind.
Experts ruled out ALS, spinal muscular atrophy, and several other neuromuscular diseases. Evans never gave up his search for answers.
It was in that early 2010s, that anxiety or that frantic search of maybe there's someone else, maybe there's another doctor, maybe there's another test, maybe there's another research institution that knows this, maybe there's something else. And that's what caused the emails to doctors in other parts of the country, emails to doctors in, heck, I've even emailed with a doctor in France before, and so forth, about, do you have a test? Have you seen something like this? Are you interested in seeing me? Do you think you can help?
Feeling like there is nowhere to go and having these symptoms, oftentimes having severe medical issues and just not knowing what's causing them and not being able to find answers is an incredibly difficult situation for anyone to be in.
That's Kimberly LeBlanc, a genetic counselor and associate director of research operations at the Undiagnosed Diseases Coordinating Center at Harvard Medical School. She says that before 2015, undiagnosed patients had nowhere to turn once they exhausted their own resources. They carried the financial burden to both find and fund research on their own. Now these patients and their families can turn to the Undiagnosed Diseases Network, also known as the UDN, founded in 2015 by Dr. William Gall of the National Institutes of Health, which also funds the network. The UDN consists of 12 interconnected research centers across the U.S. that focus exclusively on rare and undiagnosed diseases. Patients who've tried every possible avenue to find a diagnosis can apply to the UDN for acceptance into the research program.
It's an extensive medical record review process. The evaluation, if a patient is admitted into the program, the evaluation is what involves seeing the patient in person or via telehealth and exploring symptoms that they have.
UDN researchers have successfully found a diagnosis for 30% of patients enrolled in the network. They're the lucky ones who finally have the long sought-after answers to what's driving their illness and can now follow a specific treatment plan.
The other 70%, we continue to look at their data, information over time. Part of that 70% does have active research ongoing. We have a model organism screening center that's able to follow up on findings that are discovered through the evaluation process. So some of the undiagnosed patients fall into that category, or there's ongoing research with a collaborator outside of the network. So for that 70%, a portion have active research ongoing, and the other portion we're going back to their data over time to see, has the medical field advanced, or there are explanations for their symptoms now that may not have been known a few years ago.
I don't have a background in genetics, in biology, in medicine, and yet I had a feeling like this was going to be on my shoulders to continue researching articles, journals, potential doctors, research scientists, etc. That brought a high level of anxiety for a number of years. Once I found the UDN, I don't have that feeling anymore. The feeling I have now is that I've found that team. I've found the people that, if this is going to be discovered, I've found the team that's going to do it. And it lets me take a deeper breath and a sigh and know that, okay, it's not done today, may not be done tomorrow, but the people are working on it.
Hallie says she'll never forget the day she heard about the UDN. Everyone around her was shrugging their shoulders, saying maybe you've been hit by lightning 3 times and Philip's symptoms are all unrelated.
Fortunately, this young trainee, I'll never forget his face, looked at us and said, I think you guys would be good candidates for the Undiagnosed Diseases Network. I didn't even realize there was such a thing as undiagnosed disease at that point. You kind of have this impression of the healthcare system when you're first really embedded in it, like we were that first couple of years, that they kind of can figure out anything with enough time. It's really, I think that's probably the case for most people. They don't realize that there are individuals who have complex, chronic, ongoing medical problems that don't have a clear, unifying diagnosis.
Both Hallie and Evans are co-chairs of the Undiagnosed Diseases Network Participant Engagement and Empowerment Resource, or PEER.
It's hard to imagine. It's hard for people to imagine. It's hard to articulate, and it's part of why, connecting with the PEER group has been so wonderful for me, is because I have other parents who understand kind of the morass of uncertainty that we all live in, that is really at a level that is different. It's a different experience than other medical challenges.
But how does one deal with this much uncertainty? Do the challenges become too much to bear?
The moments when I do really fall apart every time kind of a new symptom pops up and we just don't know what to do with it. The day-to-day is very much focused on what's in front of you. Which medication is due next. We have 2 other children. I work full-time. My husband works full-time. We have a very busy family life. And so, it's really the moments where, the quiet moments where when you try to think about the big picture, it does get overwhelming for sure. But, we'll just keep fighting.
But Hallie says there are good days, too.
Being part of the UDN, part of what's really inspiring about that is, I have a good friend, a mom who's on peer, whose daughter, after many more years in Phillip in the UDN, finally has a diagnosis. And, she has a way to connect with other families and pursue treatment options. And if nothing else, have the peace of mind of being able to move forward a little bit. So, having them, knowing them and having them be close people in my life, it really helps me keep that positive perspective.
The UDN has created a blog where patients can upload their medical profile in hopes that someone else with similar symptoms will see it. A match with another patient enhances researchers' chances of finding the gene that might cause the disease and thus bring a diagnosis within closer reach.
It's like a weird version of Match.com. Find your person. But my friend Sarah, who's also a peer member, she just went through that with her daughter Phoebe, and they managed to find a diagnosis in part by finding other patients who had similar phenotypes.
However, unless lobbying efforts are successful, NIH funding of the Undiagnosed Diseases Network will expire in 2022.
At this point, without at least some federal action to continue to fund at least a portion of the program, they could go away and basically fill up, and 60% who haven't gotten a diagnosis kind of are going to be left with no place to go. So it's particularly scary because you just have no idea what the future holds for this beautiful child. I mean, Phillip is rambunctious and funny and sweet and, in many ways has done incredibly well given all of his challenges. He's going to school. He made his first friend this year. He's a joy, much more so than he is a challenge. I think we're on the verge of really doing a terrible wrong to a really large group of patients and families that have been mostly invisible and haven't had a place to go, including ours. And I can't not talk about this publicly because I just don't know what we're going to do if the program goes away.
What's ironic is the last week of February 2020, I was in D.C. advocating on behalf of rare diseases for things such as the UDN. And, of course, COVID was starting to hit the shores of the United States at that time. By that first week of March, it really took on a scary factor. And by the second week of March, there's an unknown disease. There's an unknown origin of the disease. There is no known therapeutic path for the disease. Yeah, that's the scary world that many undiagnosed patients live with.
You can only imagine what life would be like now if researchers hadn't found a diagnosis for COVID-19. No treatments, no vaccines. It's a scary thought. You can learn more about all of our guests and the Undiagnosed Diseases Network by visiting our website at radiohealthjournal.org. Our writer-producer this week is Polly Hansen. I'm Reed Pence.
Summertime offers the opportunity to refocus on lifestyles that promote health, including more outdoor activity and eating more fresh, seasonal foods. Fruit is the perfect summer snack, and heart-healthy grapes are a smart choice, according to dietitian Courtney Romano, health advisor to the California Table Grape Commission.
When it comes to snacking, fresh grapes are always a great choice. They're healthy and hydrating with a juicy pop of flavor, and always ripe and ready to eat when you buy them. A smart alternative to processed snacks that come with added salt, fat, and sugar. Try freezing grapes for an all-natural frozen treat. They're like mini sorbets.
Grapes from California are in season now. Grapes of all colors, red, green, and black, are a natural source of beneficial antioxidants and other polyphenols, which research suggests contribute to a healthy heart. Visit grapesfromcalifornia.com for more summer cool ideas.
COVID-19 vaccines are rolling out, and many Americans are looking forward to getting back to normal. However, chronic stress of the past year can impact memory, mood, and anxiety. So during June, Alzheimer's and Brain Awareness Month, the Alzheimer's Association reminds you to make brain health a priority. Beth Kallmeyer, Vice President of Care and Support for the Alzheimer's Association, has tips to restore mental well-being.
First, think about recommitting to brain-healthy basics, like regular exercise, a heart-healthy diet, and getting plenty of sleep. Try to unplug from technology every night. Do what you can to manage your own stress, especially if you're a caregiver for a person living with Alzheimer's or dementia. And return to normal at your own pace by taking small steps and setting boundaries.
Kallmeyer says it also helps the brain to help others by volunteering in your community. For example, by supporting the Alzheimer's Association's The Longest Day event, June 20th. Find out more about Alzheimer's and Brain Awareness Month at alz.org.
If you receive a cancer diagnosis, there will be many things to learn and manage. One is understanding that cancer and some cancer treatments can increase the risk for blood clots, especially in the first few months after diagnosis. Dr. Alok Khurana, professor of medicine, Cleveland Clinic Lerner College of Medicine, says it's important to create a plan to protect your health.
Make sure your cancer doctor knows if you have a family history of blood clots and that you recognize the signs and symptoms of blood clots. Signs of a blood clot in the leg or arm include pain and swelling with skin that's warm to the touch, red or discolored. Signs of a blood clot in your lung are difficulty breathing, chest pain that worsens with a deep breath, coughing up blood, and a faster than normal or irregular heartbeat.
1 in 5 blood clots are associated with cancer. Knowing your risk, signs, and symptoms will help to protect your health. Learn more from the CDC and the National Blood Clot Alliance at stoptheclot.org/spreadtheword.
Birds are chirping, flowers are blooming, and your allergy symptoms are knocking you out once again. If every year you dread warmer weather because you can't seem to get ahead of your allergy symptoms, and if you feel as though you've tried every medication in your local pharmacy, it may be time to see an allergist. Dr. Luz Fonisher, president of the American College of Allergy, Asthma, and Immunology, says sometimes over-the-counter medications just don't cut it.
Allergists are trained to work with you to get allergy and asthma symptoms under control. They can do testing to diagnose exactly what you're allergic to and also determine if treatments such as immunotherapy in the form of allergy shots or tablets might be effective. Allergists are also asthma specialists. Many people don't know that asthma is often connected to your allergies.
If your allergies are making you miserable and you need expert help, find an allergist near you. The American College of Allergy, Asthma, and Immunology has an allergist locator on their website at acaai.org.
And that's Radio Health Journal for this week. Radio Health Journal is a production of MediaTrax Communications. Follow us on Twitter, Facebook, and Instagram to learn more, and check Apple Podcasts, Google Play, and Spotify for a library of past programs. Plus, you'll always find previous segments and information about our guests at radiohealthjournal.org. Join us again next week for another edition of Radio Health Journal.
Coming up next week on Radio Health Journal.
Our society did what it had to do, a very serious health condition. But now we have to deal with the consequences.
How widespread mask use has impacted language development in children.
Then how air pollution near refineries may threaten hundreds of thousands of their neighbors.
Over a 2-week period, you saw benzene at levels that you're not supposed to be exposed to even for 10 hours without wearing respirators.
All that and more on Radio Health Journal.